good morning, or good evening, wherever you are. Today, we are going to conduct our, actually it was supposed to our first session, but due to some networking problems at Eastern African countries, we are going to conduct the European Public Health Week's first session topic with the topic of global health challenges. So as you may remember, we started as the Society for Public Health Thinking and Innovation group. We started the week with the opening speech of Professor Mustafa Taşdemir. He's kindly accompanying us today again in this session, and we will hear his thoughts at the end of all the sessions of the young professionals from Turkey. So, but today in this session, our main speaker will be Dr. Mehmet Güllüoğlu. I will briefly introduce him to you. So, Dr. Mehmet Güllüoğlu is currently the ambassador of Turkey to Dar es Salaam in Tanzania. And he's a medical doctor, and he holds a PhD degree in public health. He has several management experiences in Ministry of Health, Turkish Red Crescent, and Disaster and Emergency Management Authority of Turkey, which is called also AFAD. And he has worked as a volunteer doctor in many countries, in eight projects, and in many non-governmental organizations projects. And he's a very experienced young professional in public health, and we are very glad to have him today in this session. And I'm very excited to moderating the sessions also, so forgive my speech and my excitement. So, Professor Dr. Güllüoğlu, and hopefully Professor in the future, the floor is yours. Please continue.
I hope so. Dr. Sabanur and dear Dr. Mustafa, dear my professor also, and all audiences. I'm also greeting you from Tanzania, from Salam. Again, as you said, we were planning as the first session, but I think it will be the last session for the Public Health Week for Europe. Again, good morning and good afternoon for everybody. In fact, we were the first session we planned, and to start a discussion about some change in the world and some global challenges in the world. Although it is the last session, but these discussions will continue in all public health areas, which we will discuss. I don't know if my presentation is already seen.
Yes, we can see the presentation.
Okay. Just I can directly. In fact, what I will tell you will be based on one research, but I will try to take your focus on changing from the global health perspective and global populations, in fact. In the world, the population is always important when you go from the country-wise, from the continent perspective, or from the world perspective, because the world is not a stable place. Even the policies are not only one stable place. I will try to share some changes in the world from the population perspective. The first one, in the first video, which is the video for graphic, I will be sharing the world's population, Asia, Africa, and Europe's population, how it changed from 1950s till to date, and what is the projection until the 2100. In the first one, you know, the world's population was, let me, when I put it goes, but let's see the video first, how the change will be coming as a projection. Europe's population was more than Africa, but by 2000s, the Africa's population is now more than Europe. And in the low fertility scenario, the world's population will be decreasing, but Asia's population also will be decreasing. But Africa's population until 2100, the population will be increasing. And in Europe also, the population in the 2000, it roughly saw its highest number. And because of the low fertility rates and including policies, it is now going down. But this is for the projection. In fact, we don't have, exact estimations. We have scenarios. We have 3 scenarios. The low fertility, medium fertility, and also high fertility scenarios. The first one was in the low fertility. In that one, the estimation will be even decreasing from 8 billion population to the 7.7 billion population. But in the medium fertility scenario, the world's population in the plateau, it will reach to the 10.4 billion population. And that time, the graphic is roughly will be like this. How it will be changing will be like this. Again, Asia's population is increasing, but Africa's acceleration rate is much more, because in Asia, even in the China and in India, especially in China, there is a strong family planning policies. That's why it is even decreasing. But in Africa, until the plateau, still the population increase will be coming. In the high fertility, yes, please.
You talk about 3 scenarios: middle fertility, low fertility, high fertility. The level of fertility is for all 3 groups, both world, Asia, and Africa.
In fact, this is from the UN's estimations for different continents. A global estimation?
Yeah, let's say middle fertility is for both world, Asia, and Africa.
Yes.
For all of them.
Yes, for all of them. These graphics are for all of them.
Okay.
In fact, UN has estimations for each country, 3 scenarios, because each country's fertility rates are different. And even in the low, medium, and in high fertilities, UN has 3 scenarios for these population estimations. And when they gather by the continent and the world, we have these datas. It's okay, Professor Mustafa?
Okay, yeah, maybe for Africa, high fertility scenario will be realized, but for Europe, low fertility, for example.
It is
Yeah.
the difficult.
Yeah.
These are scenarios.
Likely, I think.
In fact, we will be discussing some points about this, but that's why we call it scenario. We don't have exact figures, and we can't have exact figures, because although there are some targets, global targets for different health targets, including sustainable development goals, on the reality, it is not going always like that. In some countries, in some continents, we can reach or we can close to the targets, but in some of them, we can't catch or we can't really close to the targets. That's why these are scenarios, and you're right. In some countries, the one of these scenario can be, but in some countries it can be less or it can be higher than the even high expectations of the scenarios. This is maybe that's why difficult to estimate the future. But also in the high fertility scenarios, what is the world is expecting? Until now, these are the same because these are the depending on the facts. But after 2022, it is all high fertility, and the world's population is passing more than 14 billion. Africa's population is more than 5 billion. It means 1/3 of the people all around the world will be from Africa. but especially I want to give a perspective from Africa, and this is 5 top African countries in the low fertility scenario, how they will be changing. And even in the this view is from the 2100 year. The graphics are different even between each other. Some of them are still increasing. Some of them even started to decrease. Some of them already started earlier. And South Africa, for example, started the family planning policies, even will be starting, they are already discussing. How the change will be? In the first Nigeria, Egypt, Ethiopia, South Africa, and Tanzania, and even in the 1950s, the population of Nigeria was about less than 40 million. Egypt, Ethiopia is around 20 million. South Africa is slightly above than 10 million, and Tanzania is about 9 million. But by time, some things are happening, and especially in 1970s in Nigeria and in different countries also, the acceleration rate is increasing. And the estimated, even in the low fertility rates, for example, for Nigeria is around 400 million. It was less than 40 million in 1950s. In Nigeria, it is estimated that less than 400 million. It is in the low fertility scenario. Ethiopia is more than 250, close to 250. Tanzania is 170 million. Egypt is just less than 150 million, and South Africa less than or around to 50 million. This is in the low fertility scenarios. In the medium fertility scenario, it is again, but all of them, it is increasing. And in fact, even in the low fertility or middle fertility, Africa's population is decreasing. But between the countries, there can be some change because some of them already has some policies, but some of them is, again, not catching those targets. But in the medium fertility, Nigeria's population will be more than 500 million, even close to 550 million. Ethiopia is passing 300 million. Tanzania is passing 240 million, and it goes. And for high fertility, which is possible, as you said, Professor Mustafa, because in the Europe it can be low fertility scenario, but in Africa can be it's then high fertility scenarios. Then the accelerated rate is becoming much more, and the estimated even in the projection for the population for this top 5 African countries is much more. And Nigeria itself, it is becoming more than 700 million. Ethiopia becomes more than 450 million. Tanzania is more than 300 million. Egypt close to 300 million. And South Africa is around 100 million. To understand this change in different parts of the world, when we look at all from Africa, it is close in each other. But to understand the change in the population from historical perspective and from different culture and different continents, I wanted to share 5 African countries plus Japan, because from the population pyramid, Japan also shows us an important sample. This is from the low fertility scenarios. I wrote high, but this is low fertility. Just before the starting the video, I just want to first hold on. In Japan, in 1950s, the population was more than 80 million, and Nigeria's population was less than 40 million. And other countries was about or less than 20 million. It was really, I mean, not that much populated countries in 1950s. But by time, what is happening? Japan's population is passing 120 million. But Nigeria at that time and other African countries, at that time it was rising. And for example, in 1950, in 1920s, let's say that in these years, let's come to that. For example, last year's statistics, Japan already is in a plateau and started to decrease. Nigeria is already past 230 million. Ethiopia, Egypt is around again 120 million. which is they are increasing in a very high acceleration rate. Tanzania is the acceleration rate is also coming with a very high level, and South Africa in the next years will be starting because they have some family planning policies will be coming. But then by years, by decades, because of also the population pyramids show us this one, Nigeria by 2100 will be around 400 million. Ethiopia is again 230 million. I mean, my aim to show this one and this comparison in the world by time, especially the African countries, will be needing different policies and approaches and different budgets from the public health perspective, from the health economy perspective, even from the global or country-wise perspective. And in Japan, they will have another difficulties. They will have less population, 50 million population, and with a high percentage of the elderlies. And they will have another challenge at the same time. I mean, Nigeria or Ethiopia will be having a different challenge, but Japan will be having different challenge. I want to share another sample from South Korea. South Korea's currently the population is 51.8 million population, and with an 0.8 fertility rate, which is one of the very few one in the world. In 1990s, the population was 44.3 million. In 2017, it was 52.7 million. And in the forecasted, it is estimated that the population will be nearly half of it, 26 million. And the population pyramid will be like this. In 1990s, they had much more youth population, and there was less senior elderly people population. But in the yellow one, I think in 2100, they will have a huge burden from the elderly population, and they will have a less young population, which we will be discussing and which needs to be discussed, not only from the health policies, not only from the public health perspective, because these are affecting a lot of policies from labor power, from production capacity, and in each field, these are important parameters. Again, the fertility rate is currently 0.8. Even if they can keep it, this will be nearly half of the global forecasted fertility rate in the world. You know, in last days also, even in Turkey, there are discussions about the changing fertility rates, how and it can affect the countries. Another thing from the health policies and including public health policies, the reasons, the causes of the deaths in different countries, it is again changing by years, by decades. Much more NCDs and less infectious diseases, and different reasons are coming and going. For example, in Korea, again, this is from Korea, mostly NCDs, and the reasons maybe can be related to the age, and also like cancers, like stroke, Alzheimer, and also self-harm, something specific for the South Korea, are in the Korea's top 10 causes for the deaths. I want to share another sample. Sorry, the population is not 51. This is from the Korea. I'm sorry. It was 51 in 1990s, but in 17 years it is doubled in Ethiopia, and in 2100 it will be again doubled, and it is estimated to pass more than 220 million, which will be again one of the most populated country in the Africa. And the population pyramid is also, it is weird because even in Tanzania, I will be sharing, these countries currently have a young population, has a huge young population, and by time they will have again a senior group, an elderly group, plus they will have a young population. That's why in Europe or in Korea, in Japan, they will be having different challenges, but in African countries, they will have some extra challenges. They will have elderly people's needs and the population, and also they will have a huge young population. But also in Ethiopia, a big old population, I mean senior people's, elderly people's population is they are expecting for them. Fertility rate is even decreasing in Ethiopia, is expected to be decreasing. How we can say this? In 1990 it was 6.8. In 2021 it is in a decreasing rate. And the estimation and also even the policies, even it will be decreasing because peoples are migrating from rural areas to the urban areas. The conditions are changing. Even in all Africa, the fertility rate is going on the trend to decrease. But in the cause of the most of the deaths, as I said, NCDs plus infectious diseases is, I think, they will be continuing to be on the most important causes for the deaths. In 10 years ago, it was, by the way, there was a specific statistics for COVID-19 in 2021, but except that one, neonatal disorders, again, infectious, including diarrheal disease, tuberculosis, are one of the important ones, and congenital defects because of high fertility rate also. Before starting the discussion, I want to give also some ideas from the country where I work and live. Tanzania, at the same time, with the increasing population of the Tanzania, at the NCDs are currently about 34% of the deaths in 2019, which is also increasing. But plus, at the same time, Tanzania is faced and challenged with the malaria, HIV, and tuberculosis. Because of the lack of the infrastructure, because of the lack of enough health facilities, preventive measures, and in fact, even including health education, because there are problems in the general education services. The Tanzania, and even we can discuss broadly Africa, will be challenging both sides. The demand for the health services are increasing, but the governments are not can increase those services at the same speed. Although in each country, in each year, Tanzania has extra 1.5 million or even close to 2 million population, the number of the beds, number of the health facilities, number of the doctors increase is not on the same level for these. The acceleration rates are not same. That's why on one hand the increases are increasing, but the services are not giving on the same rate. That's why for these countries there is extra challenge. The need for the service when it is increasing, the service supply is not in the same level. And by time, as I said, the elderly population will be more, and not with a not decreased young population. From different countries, in fact, this is a global perspective I wanted to give. But from each country level, I think the organizations should be discussing about these scenarios from different perspectives. Because today I had some guests from Tanzanian Dental Association. From each perspective, they should be sharing and making preparations what they can do. And from the European perspective, the needs are different. And from Asian perspective, it is the needs and challenges are different. And from Africa, it is different. But as I said, this is not only from public health perspective, from economic perspective, from education perspective, from infrastructure perspective. I think these discussions are needed. Because of my experience in the government, I know that the budget is a competition. In each budget planning, the ministries, the organizations are in a competition to take more from the pie, because there's one pie, and from the defense side to the education, to the infrastructure, to the health, even in the government there's a competition to take much more. But I think the organizations, I mean, from different scales and from different levels, should be considering all of these changes. And as a public health professionals, I think we must be guiding we can be guiding and assisting with the statistical organizations. That's why the statistics are also very important for these scenarios to understand the change and what kind of manipulations, what kind of interventions, let's say, that can be done to manage these results. I think we should be discussing, because this is not only from the budget and the needs, also it means a labor force, also it means the social security funds. If there is enough population, the social security can continue. If there is enough manpower, the economy, the production can continue. That's why I think these discussions are not totally separate in each other. I mean, the economists, health professionals, finance ministries, they should really cooperate in each other. And that's why I think we planned our discussion as one of the first discussion to discuss more. Even in Turkey, in the last weeks, it was one of the agenda in the news, the decreasing fertility rates. But it is not only in Turkey, all around the world. I think this is an area to discuss. I just wanted to make an entrance by saying this. And we didn't touch some points, although we mentioned there are some crises which can affect all of these estimations, these scenarios. 2 years ago, in 2020 and 2021, in fact, 3 and 4 years ago, when COVID came, it all changed the approach for the health and even the health infrastructure. In some countries, it affects positively, I mean, relatively positively. The governments spend much more on health infrastructure. But in some areas, it affects negatively because of the decreasing economies. Or conflicts in different countries can change dramatically and really aggressively these policies and these plans, because we know that from the anthropology and from the social perspective, in the crisis times, the fertility rates are increasing on one hand, but the infrastructure, health facilities, health services are affected also dramatically. That's why, although we discussed some scenarios, these scenarios are not we're not considering those possible crises from the country perspective, or even it can be a pandemic, it can be a global perspective. That's why even the crisis which we don't know in which country, in which continent, or even globally can come and probably will come, but we don't know where and when, affect these scenarios. That's why we must be really ready for this kind of challenge. But we must be discussing different scenarios, different ideas in this perspective. And last but not least one, also peace as an health parameter. I mean, people want, in all over the world, people want stability. People want services. I mean, education services, security, health services. I mean, sustainable food. I mean, food security. These are the basic needs for the human being. I mean, wherever you are. Health is also important. I mean, determinant for the economy and determinant for the life. But global perspective, I mean, peace and health relation is very important, because if there is no peace, not only the health, most of the services are gone. That's why even as a determinant of the peace, health is an important factor. If there is health services, peace is more stable in there. But if there is the problems of the health services, education services, the possibility for the conflict is decreasing in there. That's why as much as the countries can invest on the health services, including health services, the peace and possibility of the lower conflict is decreasing in there, because nobody wants to give up from their comfort, from their doctor, from their teachers, from their, I mean, stable conditions. That's why from the policymakers level, not only health policy, from the higher perspective of the policy makers level, I think this must be always mentioned and used on the positive and on the benefit for the human being, benefit for the civilians. Health can be used as a parameter for the peace. I think as the public health professionals, I think we should be advocating for these approaches. And then I can say we can start for discussions.
Thank you, Dr. Güloğlu, for these insights. I think it should be a start point for the discussion throughout the week. But I think this the issues about population that you addressed, it summed up all of the other discussions and arguments, not arguments, but some other thoughts throughout the week that we talk about. We talk about, you know, aging populations, considering elderly people in cities, in urban life, and we talk about universal health coverage, and we talk about public and private sector and multi-sectoral collaborations throughout the week. And the insights about you gave us a more global perspective on these topics, but I believe these insights, these issues that you addressed, well, they are very compatible about all the other discussions that we talk about. So I have questions. When we were talking about this session, I remember we talked about conflicts as well. When we talk about conflict, we remember firstly remember African countries, but nowadays, of course, there is a terrible war in Gaza, and conflicts are not just the problem of a part of the world. All of the countries they're facing but they're facing conflicts all the time. So considering these populational changes, do you have any, can you share your opinions on how, for instance, African countries, Turkey, or since this is European Public Health Week, how the other countries should be prepared for these conflicts, and what can you say about the effects of the conflicts on these changing populations? Because you mentioned at the beginning, you mentioned 3 scenarios, but I remember that these scenarios are just estimations, and the other possible crises, the natural disasters or climate change crisis or other crises, they are not taken in part when they are evaluating these, making these assumptions or estimates. So can you share your thoughts about it?
Of course. In fact, these areas are really difficult areas, because just for climate change, there is a specific UN agency, or just for migration, there are in fact 2 different UN agencies. One of them is UNHCR, and another of them is IOM. For environment programs, it is in fact climate change is one of the main driving factors. UN Environment Program. In fact, we will be challenging a lot of these questions in the next decades. Maybe in our whole professional life, we will be facing these challenges. According to my experience in the conflict zones or in the disaster areas, in fact, conflict is the easy one, or when disaster happens, the response is the short one. But starting from the conflict, peace building is a difficult point. Peace building is the main point I think the policymakers should be working on together. But to tell the truth, we saw at the same time in these years the hypocrisy of some leaders. Although I can directly say some Western countries, including US or in some European countries, on one side, some of them are really trying to build the peace. Today, for example, in this the ongoing conflict, but some of them are nearly triggering the conflict. The international relations perspective, it is exactly an extra difficult situations. from the migration, which is also very much related with the climate change as a main cause, and also conflicts as another cause. This is like domino which can come. And for example, from European perspective, although the Europe's population will be decreasing, but with the migrants from Africa, with the migrants from Middle East, even from Asia, nobody can exactly estimate what will the population of the Europe, or including transition countries, even including Turkey, can be. Because even in the internal politics, it can be an important discussion which can affect the elections in Europe or in different countries. But what we should, estimate as a public health professionals, these are possible areas which also in last more than 10 years in Turkey, migrants' health is an important area for public health professionals and from the public health organizations. I think we must be very open and dynamic to catch the needs of the countries, what I can say. Second, to be ready in the challenging conditions. For example, how to increase, how to elevate the health services in the conflict zones, or how to give the health services for the migrants populations. I think as the, professionals, health professionals broadly, and including ministries, should be thinking and ready for this one. Another challenging point, for example, for Europe, most of their migration policies, they said that we should decrease the migration and only its own source. For example, for Afghanistan, for Syria, or for Africa, we should help those countries, and we should decrease the demand for migration. It is easy to say, but it is really very difficult to implement. How to realize the projects in Afghanistan, how to realize the projects in Syria, how to realize projects in African countries, and people will stay in there. These are really, easy to say, but very hard to implement ideas. But we really need this. Otherwise, the world will be very difficult to estimate and make planning. But we will face, Dr. Sabanur, these challenges, conflict, climate change, and migration. In next decades, we will hear and speak a lot of these topics.
Thank you for the answer. Actually, I intentionally asked more about these topics because I know that there are some young health professionals listening us, joining us today. So I intentionally asked you about this topic, actually, and thank you. I think it's important to address these issues more than usual, and it's important to be aware of these upcoming challenges and today's challenge and other upcoming challenges. So thank you for talking more about it. I received some questions. I'm not sure if the participants' question and comment session is working. There is a problem with the Teams, but if you can see the chat box, you can write in the chat. Or if you have direct communication with us, you can text me personally. So I received 2 questions and I want to read them now. The first one is a comment and a question. Thanks for your, this is from Dr. Abdullah Uçar. Thanks for your very well-structured presentation. My question is, how do you conclude the decrease of Turkey's fertility rate, which is decreasing from what was forecasted? What are the main determinants of this fast decline? Now fertility rate is about 1.5 in Turkey. From a public health perspective, which opportunities and challenges does these decrease include?
In fact, I believe and I see that from each country, there are different cultures, there are different economical conditions, and there are different factors are affecting the fertility rate. In Turkey also, we had a lot of migration, internal migration. I'm not talking about the refugees. Even in Turkey, from rural areas to the urban areas, and from eastern cities to the western cities, we had a lot of migration. I think it can be one of the factors because when people migrate, then we see that and we know that the fertility rate is decreasing, number one. Number two, the economical conditions and the beliefs, in fact, are changing. People are now believing that, but these are all needed to be documented by different publications, different research. We should have less kids and more educated. But this is, as I said, for different countries. I think there are different factors affecting the fertility rate. In Turkey, although I mean our president, Mr. Erdogan, was insisting on 3, it was not only just a political approach. As the public health professionals, we know that for at least to be stable for a population, we need a fertility rate of the 2.1. But unfortunately, it is decreasing. In a Turkey, like in a country like Turkey, we were in a production period. We were in a production window. For our production, for our continuing of the economical growth, we need much more exports. It means we need much more labor force. To continue this, we also need a young population. But current statistics says that we will continue like the young population for a while, but by decades, it will be decreasing. But as I said, this is not only from the health perspective, from the sociology and from anthropology, from economical perspective, from the city planning. I mean, we need a different approach for this one, urbanization. I mean, the manpower in the agriculture. And these are all, I think, linked topics in each other. And of course, the health is a parameter and also an affected parameter as a result of what is from these changes. From the economical perspective, I mean, we are not an economist, I'm not an economist, but these population changes or fertility changes should alarm from some perspectives, because if you don't, if you can have a factory, but if you can't find enough manpower, enough labor force, this is another threat for your factory, for your production, at the end, for the country. You will increase more robotic systems, or I mean, you will need, you should increase the salaries and some other. These are all parameters for the economics. I don't have direct answer and the direct maybe research for this question, but these are the factors what we know from different countries. And we have some samples, as I said, Japan, Korea, some European countries. There are some samples in Europe. Now they also give incentives if you have more kids. But in Japan and in Korea, I think they passed that threshold. They don't want kids, even they don't marry. And even the government gives any incentives, people doesn't want family or kids. That's why the fertility rate in Korea is 0.8. That's why from the government perspective, I think even the policymakers should be discussing and be understanding about in next development plans, how to, I mean, make interventions to change these rates.
Yeah, at the opening session, Professor Mustafa reminded us the Sustainable Development Goals. Actually, the goals and the topics of these goals covers the multifactorial relations that you mentioned just now. And I don't see any other questions in chat, so I received another question from Dr. Abdullah, and I'm not sure if we have. I'm not sure it's a technical question, but I want to direct it. He's asking why is the UN comparing populations by geographical continents instead of WHO country regions or World Bank's country classification? Is there a special reason that you are aware of?
I mean, in the UN system, they use different classifications. I mean, not only one system, but even the WHO has African region and continent approach. This is just, I think a small detail how to approach. In fact, I think for these kind of approach, the country-wise country by country should be the main one, because even in Africa, the Northern Africa, South Africa, or the Sub-Saharan Africa, can be totally different in each other. Or in Asia, I mean, Afghanistan, Pakistan, India, Bangladesh, or China or Korea can be totally different ones. But just I used to give a broad idea for discussion and to open a discussion. But I think the main approach should be country-wise, because these factors are not only technical factors. It includes a lot of social sciences approach. It includes economical approach. It includes beliefs. It includes maybe religion. That's why I think country-based approach should give us a more, a precise approach.
I think I missed a question in the chat box, so my technical team directed the question. So I believe this question is from Professor Mustafa. Some say that Africa will be the shining star of the future. What do you think about that saying?
Yes and no, because yes, the economies of Africa is increasing. It is in fact not increasing, it is booming. It is really developing. But challenges and threats are also increasing. In Tanzania, when we meet with the authorities, I always say them that you are, for example, this young population, their median age is around 18, which is, half of the population is 18 or under. But if they cannot create enough job for them, if they cannot create enough services, health services, education services, millions of young people will be just sitting, will be just waiting. In these conditions, we know that the terror can increase in those conditions, and the poverty is also increasing. That's why, yes, potentially, and with the, economical resources, from mining to the agriculture potential, from economic perspective, it is a shining continent, but at the same time, it has a lot of threats and weakness at the same time. Again, I want to repeat, the demand for the services is increasing in a very high acceleration rate, but the supply for services, supply for education, supply for health services, supply for infrastructure services is not on the same level. That's why yes and no for that question. It can be very important continent for the conflicts, for the wars, and for big migration resource for the Europe and other countries. But also it can be very important country. It can be very important continent for the production, for the development, and maybe for the metropole cities. That's why the policies and these scenarios will show us how it will change.
And the last question that, sorry, go ahead.
Before the next question, from the historical perspective, we know that Africa was not only known as the continent of the poor people. In Africa, we know that there was really rich civilizations. Like in Ethiopia, there was Aksum Empire, or in Mali, there was Mansa Musa, which was recorded one of the richest person in the world. Or in different parts of Africa, there was big civilizations, and there was really rich civilizations. In Ibn Battuta's books, for example, in Tanzania, there was a small state called Kilwa, and it was, he describes that it was one of the most beautiful city and state in the world he saw. That's why, from the historical perspective, the continents, the countries has up and downs. But these policies will show us in the future which countries will be rising and which countries will be affecting from these changes.
The last question that I received is, what's the escape plan for aging populations? How will they meet their healthcare needs, especially for the elderly population? If the answer is global labor market, is it possible to share this market capacity fairly?
this is another challenge for all country. I mean, not only for specific country, for all country, because I know that, for example, from the Japan, from Korea, and including from some European countries, elderly populations, I mean, health services is a really challenge because they don't have enough manpower to take care of their elderly population. From African population, from African countries' perspective, it is another challenge because even they can't cover yet for this population level. And as much as the NCDs are increasing, as much as the population rate for the elderly people are increasing, they will have much more NCDs, much more, I mean, needs for those elderly health needs. I think it will be, as I said, as I defined, it will be a double challenge for these countries. But what I can say from today, from 2024, the world is not ready to take care of the elderly population for today and for the future. The policymakers also should be thinking about this aging population. I know there is an, I mean, concept policy, healthy aging. I think it must be more encouraged. It must be more promoted. But this is not also an easy task to do, to realize. But this preventive approach, healthy aging, I think should be one of the important thing for the policymakers. Otherwise, it will be more difficult, more expensive, and more challenging.
And since we are talking about political decisions related to health and global health challenges, we have another important question from Professor Mustafa. He's asking about the decolonialism process in Africa. Decolonization. I'm sorry about the process.
I mean, I got the point.
Yeah.
Fact, this will be my personal opinion, not as an official opinion. But the colonization was a process, and in fact, it is a process. It's a still process. If you look at the definition of the colonization, taking the resources of the countries and moving to the other countries, it can include slaves, it can include minings, it can include different material, different resources. It is still continuing by different ways. That's why I can't directly and clearly say that there's a decolonization period. There is a neo-colonization period. Not only I'm saying this, there are some professors about international relations, even they are mentioning it. This is called neo-colonization period. In the West Africa, for example, the France still has, the France central bank is still responsible for 14 countries' money print. Or the main minings for Mali, for some West African countries are still in France, or in East Africa, different countries, or in Asia. I mean, in the neo-colonization period, it is continuing. Even it has relation with the health policies and health facilities. In the traditional colonization period, some countries invested on their colonies, but some of them they didn't. That's why for the countries which they didn't invest, they are still suffering. In the countries which they invest, they are relatively better than the others. But colonization is a, I think, type of mentality, how the countries approaching each other. Feeling of some nations to another's, this supremacy is an, I think, we should be fighting. Although in the international documents, we all say that all humans are equal, but on the fact, this is not happening. I mean, in the United Nations systems, even in international mechanisms, it is not happening. This is not directly related to today's our topic, but it is indirectly related. In the yesterday's international court's prosecutor was saying that some countries were approaching to him, to Kerim Khan, was saying that this court is established for African countries and for Putin, for Russia. It means for other countries, they didn't think that they will be questioned. They will be in this court. This is an important area in international relations. But from the health policies perspective, from the public health perspective, even like history, the things which is happening today or will be affecting decades later or centuries later. What happened 100 years ago in Africa is still with the positive and negative things, mostly negative things are affecting African countries from the health policies perspective, from the different perspective of the daily life. That's why I can't directly call a decolonization process, but it is a different phase of the colonization, I can say.
Yeah, thank you for the question, and thank you for mentioning neocolonization, because as public health professionals, this is another term that we should, I believe we should be talking on it. We were having small discussions in our group last week about neocolonization and the term, and we will be, it reminded me the globalization, the term globalization that Professor Mustafa addressed in the opening session. And this is another term that we should be working on and talking on. Thank you for the answers, and thank you for the participants for these questions. I don't see any other questions so far. So I believe we are also at the end of our planned time. But before closing the session, thank you, Dr. Güloğlu, for your time and for the presentation and for your comments. And before I want to give the microphone to Professor Mustafa to close the European Public Health Week webinars of Hadi. We want to hear a bit more from him. But do you want to say anything, Dr. Güloğlu, before Professor, since we are closing the session?
Thank you very much for this opportunity. And again, sorry for couldn't do this last Monday because of there was a big shortage of internet in East Africa. It is some of the countries are affected in here, but these are, even as we said, this is a discussion areas. It is not only mathematics. We should use mathematics a lot, but it is not like 2 + 2 is 4. We need different approach, different scenarios, different parameters, and we need multidisciplinary and multi-stakeholder approach to understand what's happening and how to change, how to make interventions for the benefit of our countries, for the benefit of the human being. And thank you very much for your moderation, and to Professor Mustafa, and for the audiences who are with us today.
So thank you for that. Actually, I was going to address the digital crisis with the example of this internet network problem. And I read your posts about the interruptions on all the sectors in the affected countries. I mean, not just health sector, but other sectors like bank sector, the finance sector, and the other governmental agencies and other parts are affected. Actually, this is another crisis probably we should be aware of, and maybe to talk on the digital crisis. Okay, thank you. So Professor Mustafa, please share us your closing remarks about the public health, European Public Health Week webinars of Society of Public Health Thinking and Association.
Okay, thank you, Sabanur, for your successful moderation, and thank you, Dr. Güloğlu, for your unique and wonderful speech today. Dear participants, with the finalization of this webinar, the Society for Public Health Thinking and Innovation, shortly HADI, has completed its program for this year's European Public Health Week, with the main theme of health the political choice. As some of you may know, we began our discussions together on Monday, focusing on contemporary terms such as globalization, and emphasizing that public health should be a priority for all the parties within their micro ecosystem. Throughout the week, young public health professionals, promising professionals from Turkey covered several topics: the mental health of immigrants, age-friendly cities, universal health coverage indicators in an aging world, bridging the public-private sector, and finally today's topic on global health challenges of shifting populations. Last, I would like to thank all the speakers and participants, and also the organizer colleagues. I hope we will see more of these professional interactions in the future. Goodbye.
Thank you, Professor. And I also want to thank you for your kind words, and thank you for last session's participants for an interactive participation of this session. I hope to see you on our upcoming events. And thank you for your time, and have a good one.
Thank you very much. Kuhairi in Swahili, they say.
Regular.
Hoşça kalın.